welcome. If you are like me, switching from one meeting to the next, you might want a reminder of what meeting this is. So I will do that, and we'll have a chance for just a quick cycle of introductions too, but we're gonna try to get right to the meat pretty quickly. I'm Gail Chodron. I think I know everyone, but I see some slightly new faces to me. So this is the Act Early State Team Meeting. Welcome. I'm glad to see all of you. We used to have these meetings about 3 times a year, and it was a longer half-day meeting. And so sometimes if you weren't able to make one, it can be a while before you see each other. So you might see faces that are new to you today. The Act Early State Team is really focused on improving the systems of care, all the way from early identification through diagnosis and assessment and intervention for kids with developmental disabilities and their families. And it's bookended. Those goals are bookended by family engagement in that entire process, and meeting families where they're at, and then statewide coordination. So we have an aim that we all work well together to coordinate what we're doing. So hopefully that anchors you back in who we are at this particular meeting. If you are used to being at these Act Early State Team meetings and are more familiar with the half day, we've moved to a shorter meeting because of COVID. And today is the first meeting in a new pattern of how we're going to do this. We're actually going to meet more often than normal. So about every 2 months, and we'll have a 90-minute meeting. So we have a pattern of the content today that we're going to test out for the next year. So pay attention and see what you think. We'll be following up later to ask you how well it worked, or if you suggest any tweaks. So with this pattern of shorter meetings about every 2 months or so, what we decided to do with advice from the advisory group, which is some of the members here, and some feedback that we got from a broader set of team members, is to have each one meeting focus on one of the goals in the Act Early State Plan. So we are starting that today, starting with family engagement. So our entire meeting today is going to focus on that topic. And we've been very also engaged throughout all of our goals in doing more work around underrepresented, medically underserved families. So that'll also be a theme that carries through. So I will, the meeting objectives specifically for today are to highlight both what Act Early State team members ourselves are doing in relation to that family engagement goal. So we're going to use a format called lightning rounds and have 3 members of the team share some of what they're doing. So we're really looking forward to hearing that. And then a second objective is to identify family engagement strategies that we can use to reach families in ways that are culturally and linguistically appropriate. And so we've brought in speakers to share what they're doing in their project and think about what we can take away from that. And we will have discussion and interaction built into that time period. So let's do, before we switch to maybe the PowerPoint, Nicole, maybe let's leave it on faces for a second. Most of us have our videos on, or you can if you have your video, but you didn't have it on yet. Let's real quick just go around the room. We mostly know each other, so you don't need much, but just say hi, and I'll just call on people. So in the order I see you on my screen, so you know when to go. And just let us know your name and your affiliation that you want to, that feels relevant to this meeting. So I'm Gail Chodron. I'm at the Weissman Center, and I'm also a parent, and I do a lot of public health work. Bridget.
Hi, I'm Bridget Frank. I'm with Family Voices of Wisconsin, and I'm also a parent.
Sarah Esmond? Oh, you're on mute.
April, I want it noted I got to 2:37 today. Sarah Esmond with the Collaborative Center for Health Equity. I am not a parent, but I am an aunt to 57 youth around the nation and the world. Nice to see everyone.
Thank you, Sarah. And Sarah's one of our outside speakers today. Caitlin?
Hi, my name is Caitlin McNamara. I am the project coordinator for the Living Well grant at the Wisconsin Board for People with Developmental Disabilities. And Lynn Robick is a evaluator on that project. So I came at her request.
Great to have you. Lydia?
Hi, I'm Lydia Esmacher. I'm a program and policy analyst in the Bureau of Children's Services at DHS. I'm actually sitting on this meeting today for Nicole Miller, who will soon be returning.
Great. Thanks, Lydia. April?
Hi, my name is April Kigea, and I'm a community engagement specialist for the All of Us research program, and I am a parent to 4 children.
Wonderful. Thanks. Great to see you here, April. Thanks for joining us. Chris?
Hi, everyone. I'm Chris Barnico, and I'm the Actorly Ambassador to Wisconsin. And I also work at the University of Wisconsin-Milwaukee.
Great. And Tim?
Good afternoon, Tim Markle. I work out of the Wasteman Center, are in a number of different projects.
Great. Diane?
I'm Diane Gerlach. I'm a pediatrician with Aurora Healthcare, and I have 2 teenagers.
Wonderful. Lindsay?
Hi, I'm Lindsay McCurry. I'm a scientist at UW-Madison and also Director of Psychological Services at KGH.
And Barbara?
Hi, everyone. I'm Barbara Katz. I'm a parent and I'm co-director of Family Voices of Wisconsin.
Anne?
Hi, I'm Ann Harris. I'm at the Wasteman Center with Gail and with the Wiki project that helps sponsor the Actorly team, as well as Wisconsin LEND Director, which is a training program.
Becky?
Good afternoon, everyone. I'm Becky Burns. I'm the statewide coordinator for the Children and Youth with Special Health Care Needs program. I come to this work honestly as a sibling, and I'm also serve as the family delegate for AMCHIP.
Fabulous. Joe?
Hi, I'm Joe Amaral. I'm a pediatric neuropsychologist at Medical College of Wisconsin and Children's Wisconsin.
Wonderful. Leah? You're on mute.
Unmute. Hi, everyone. Leah Lovelam here. I am a public health nurse consultant with the Children and Youth with Special Healthcare Needs program and the Maternal Child Health program. And I am a parent. I have 2 grown daughters, but both my girls, we grew up with learning disabilities. So lots changed since then.
Thank you. Brian?
Hey, everybody. I'm Brian Stoltz. I'm the Operations and Events Manager at Wisconsin Head Start Association. Easy for me to remember. I'm also Vice Chair of the Board at Rock Walworth Comprehensive Family Services, as well as being a parent.
Fabulous. Hector, you show up next for me.
Hi, my name is Hector Portillo from Padres y Hijos en Acción. Also, I'm a parent.
Welcome. Ava?
Hi, I'm Eva Shaw. I'm on the special education team at the Wisconsin Department of Public Instruction.
Great to have you. Barb?
Hi, everybody. Barb Tangestal with First 5 Fox Valley. We're up here in Appleton area, and we're also the Help Me Grow state affiliate from Wisconsin state affiliate.
Fabulous. Hugh?
I'm Hugh Davis. I'm Executive Director at Wisconsin Family Ties, and I'm a parent of 4 kids, including a young man on the autism spectrum.
Great to have you. Maria?
Oh, sorry about that. Hi, I'm Maria Stanley. I'm the a developmental behavioral pediatrician, and I'm also the medical director at the Wasteman Center.
Great. Jenny?
Hi, everybody. Jenny Bibler, also at the Wisconsin Department of Public Instruction, and I'm the early childhood consultant on the special education team.
Fabulous. Naomi.
Hi, Naomi Kowald, Medical Home Project Manager with Children's Health Alliance of Wisconsin.
Great. And Jess.
Hello, everyone. I'm Jess Nichols. I work as a statewide coordinator for early childhood equitable multi-level systems of support through the Wisconsin Department of Public Instruction. And I'm sorry I can't turn my camera on. I am in rural northern Wisconsin with not enough broadband today. It's good to see all your faces.
We know how that goes. Lynn, also joining us from rural Wisconsin.
Lynn Robick, UW Wasteman Center Evaluator.
And I think Nicole.
Hi, I'm Nicole Bryce, and I'm project coordinator for the Wisconsin Care Integration Initiative.
Did I miss anybody? Okay, so thank you everyone for putting names to faces. It's good to know, to see the team before we dive into content. We really appreciate that. So welcome to the team. So